Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, for today, we are from Group 1. We'll present to you all about one of biomedical issues, which is contraception and sterilization in the context of the definition, the methods or type on both of them, and the rulings on contraception and sterilization. Okay, the first one is, what is contraception? Okay, contraception is also known as birth control and family planning, and it is any method or devices used to prevent pregnancy, and it allows the spouses to choose whether or when to have a child or a baby. Okay, next let's move to the methods of contraception. Okay, as we know, contraception prevents pregnancy by interfering the normal process of ovulation, implantation, and fertilization. Okay, so let's see the example pictures of contraception methods. As you can see here, this is condom. This is the famous way to prevent pregnancy. And the second one is oral contraceptive pills. And below here we have IUD, which is intrauterine device. And this is emergency contraceptive pills, or we can call it as morning pill, because it need to take sooner, maybe in the morning, after unprotected sexual intercourse. And also there are methods of contraceptive injection, contraceptive ring, calendar rhythm method, and the last one is coitus interruptus. Coitus interruptus is also called as withdrawal method, which means the penis will be taken out before the ejaculation.
So we move on to the ruling of the contraception. The hukum is permissible only for certain reasons, and the dalil is Jabir reported we used to practice azal or coitus interruptus during the lifetime of Allah's messenger. This reached Allah's apostle and he did not forbid us, although Rasulullah permitted it, but he did not encourage us to do that, as in another hadith, he said that he was very proud of Muslim in having many heirs in this world. A couple is permissible to make a family planning for the following reasons. The first one is to actually plan for the birth, so that the family can prepare on how to take care of the pregnancy, the labor, and even after the child is born, they can think on how to raise the baby in future. The second one, to consider for the mothers and children's health. It is proved that pregnancies in a short time can risk their health. In Surah Al-Baqarah, verse 233, it mentions about the breastfeeding of a newborn baby is 2 whole years. This also remark on how long the parents should give attention to their children, and also a suggestion of period in getting another newborn baby. And then third one is to maintain the physical and attractiveness of the wife. The wife can get her original body before pregnancy, so that the relationship between the husband and wife always in harmony. And then the last one, to prevent the parents from getting burdened, which they might involve in doing forbidden actions. They know they are having financial problem and having many kids. They absolutely sure that they will do the forbidden actions like robbery and killing children to support their household economy.
I will proceed to the definition of sterilization. Sterilization is a permanent method of contraception for people who don't want more children or any children. It works by stopping sperm from meeting an egg. So as we all know, the sterilization is a permanent method of birth control. It is not meant to be reversible. Before having the sterilization, you and your partner must be certain that you don't want any children in the future. If you have the sterilization procedure and you change your mind after the operation, you can have surgery to try to reverse it. There are 2 types of sterilization. First is male sterilization, and second is female sterilization. For the male sterilization, or known as a vasectomy, is done by cutting or sealing or tying the tube that carries sperm from the testes to the penis. This prevents a woman's egg from being fertilized with the man's sperm. So for the female sterilization, or known as a tubal ligation is done by sealing, cutting, or blocking the fallopian tube, which carry an egg from the ovary to the uterus. This prevents the egg from moving down the fallopian tube and keeps the sperm from reaching an egg.
Next, ruling of sterilisation. Based on 12 Muzakarah on 20 January 1977, sterilisation of men and women is prohibited. Prevention of birth or limiting the number of children is prohibited unless there is a reason permitted by Sharia. Family planning from other aspects not included in number 1 and number 2 is permissible. Next, we go to the issue related to sterilisation. This case I took from overseas about a 26-year-old woman requesting sterilisation. She had never been pregnant and never want children. The reason is that she did not have faith in other form of contraception, had no desire to have children, did not wish to change her lifestyle. She saw children as a financial burden and felt that children would prevent freedom to her. So how should we respond to it? The doctor should not suggest to the patient to perform the sterilisation because it is not the best option. Next, if a patient requests sterilisation because of medical reason, they must be informed of the risk and benefit of the procedure. Lastly, sterilisation for non-medical reason is unethical based on Islamic perspective.